Hello everyone, welcome back to my channel. That's Maya. Today I'm with a lady. Oh my goodness, I've never seen such a lady in my lifetime. Her name is Mariam. She's going, of course, she's going to introduce herself, and she's going to later take us, around her beautiful university. But before we do all that, she's going to tell us, about her story and whatever she does. I mean, if I could, listen to her and be like, people must know you and how strong you are. Just stay here and just know, how strong she is and whatever she's bet so far. So Mariam, I'm so happy to have you. Thank you so much for having me at your university.
I'm glad, Madam Annette.
Just nice. Call me Annette, come on.
Yeah, Annette, I'm very happy. I'm humbled to have me hosted on your YouTube channel. Thank you very much.
Yeah. Thank you so much for accepting, investing all the time. We came to the university and then we are here. We're going to do this interview for about maybe 30 minutes. Thank you so much.
Yeah.
So you can start by introducing, who you are to the audience.
So my name is Mariam, a student at Clarke International University, pursuing a diploma in clinical medicine in my second year, currently going to the third year, second semester. Yeah, basically that's all.
Where were you born? In Central?
Yeah, I was born in Central.
To
be particular, Rubaga Hospital. Yeah, I know this information. Yeah.
Okay. So what I want to ask you is about studying. So why did you choose clinical medicine, and was this something you loved to study when you were in your high school?
Oh, to give you a brief background of my passion, as I was growing as a young girl, I always wanted to do law. Right from primary, you ask, Mariam, what do you want to be? I used to tell people, I want to be a lawyer. And who is your role model? By then, the Chief Justice of Uganda was Benjamin Odochi. I immediately said that. But when I was admitted in high school, that is Mengo Senior School, I got interested in the sciences. I started loving the sciences. And my strength was in the sciences. Yes. And things, I did my senior 4, managed to score a first grade, and I was admitted again back to Mengo for my HSC. Yeah, they gave me, I offered BCM, but still the law thing was in there hiding. I went, we have a careers dean at our school, high school. They usually, at the beginning of the year, when they're admitting senior 5s, they have that, the combination and the courses you can offer at university. So still PCB and BCM had law. I said, let me just go do this thing, you never know. I be that science student in law school.
Oh wow.
Yeah. Now again, the passion of medicine comes in. After my senior 5 first term, I don't know, I got health issues. I was challenged. I fell sick for some good time.
Oh no, just like
yeah, I was in hospital, in and out of hospital. I missed my entire senior 5 second term. I was in and out of school, hospital. Yeah. So that means I got closer to the doctors, to the nurses, as they were struggling to give me a life. I started picking interest. I said, oh, this is what happens in a hospital. People, you have to work to make this person feel better. The family has a lot of hope in you. I started thinking, I said, Mariam, you can pursue this. I think something clicked into my mind. I went, I read Ben Carson. The surgeon.
In Uganda?
No. He's a famous surgeon. He has gifted hands. You've read that book?
No.
He's an American surgeon.
I don't read a book. I don't read books, related to cancer. But other than that,
he's an American surgeon. So
wow.
I read all that. I started getting, because you were in hospital, you have to somehow, you're losing hope, but to keep hopeful, when you have some energy, I used to watch movies. There is a series called The Good Doctor. It had a gentleman called Sean Murphy. He had autism, but he was a very good doctor. He was a surgeon. He's sorry. Those that have watched it can tell. So I picked interest. Now came back to school. We did our enable. I was supposed to do my senior 6 in 2018, but because of the health issues and challenges, I went back to senior 5 in 2018. Then pursued 2019, we did UNEB. Yeah, given the challenges, I wasn't able to make it for bachelor's direct, but I got the grades to admit me for the diploma course I'm offering now.
Wow, well done on that.
Yes,
well done on
I
that.
didn't give up. And yeah, the people around me, I'll take this opportunity. I know it wasn't part of the interview.
That's okay,
but
darling.
Yeah. I thank everyone, the students in Mengo, the teachers, my family, all my friends, the people that really stood with me during that trying time. May God bless you, all of you. I want to make this world a better place and impact in people's lives, because you all supported me. It wasn't a one-man thing. It wasn't my own energy, but the people, the social circle I had at the time, you guys really did a good job.
Wow.
Yeah.
Thank you to everybody.
Yes, yeah. Now, that's how I start getting passionate. I have these doctors. Had this one doctor I used to disturb in Rubaga, Dr. Linda. I used to disturb her all the time, asking her this and that. Even when my results came back, I sent her, I was like, Dr. Linda, this is what I got. What can I do? So career guidance, I had a lot of career guidance. My brother, Dr. Jumba Moses, those people were there to guide me. We walked, I remember that time when the results were back, we went to Mengo, Ikuri, we went to Medicare, we moved all these places. We went to Allied in Mulago, the Allied Institute. Then finally, Dr. Musa called a friend. Hello, he had one of his friends. He called, then they told us about Clarke International University. Formerly, it is known as International Health Sciences University, but we've rebranded. Yes. So basically, I remember the day I came to apply, Dr. Ian Clarke was around.
Oh, the founder of the university.
Yes, the founder of the university. He's the one who directed me to the registry. Yeah, the people I love the place. It was like, wow, this is nice. So we applied. And here we are 2 years down the road.
Oh, wow. Congratulations on whatever, you've achieved, on whatever you've made,
Yes.
And, all the challenges you've gone through, you've been able to, to manage, and of course, people around you. It's all about people, having people who are positive enough to also transfer that positive energy to you, to add on your energy.
Exactly.
Yeah. And you also, because it starts with you.
Yes.
People around us contribute, but it starts with you, from within you. If you are, if you're hopeful and you believe that things are going to be alright, things generally go be alright. In most cases. Yes. Congratulations on that. So I want to ask you the big question about the university. There are so many universities in Uganda. Makerere University, Uganda Christian University, IU, so many, Chambogo. Why did you use Clarke International University?
In that time, 2020, the country that just opened for the first lockdown, just opened. That's when we got admitted. And Clarke had organized it. It is one of the first universities to embrace the Odell system.
What is Odell?
Odell, it's an online distance electronic learning. Every university is having it now in Uganda, the Odell system. So I saw that they admitted us still. Even when the lockdown came back, we had our lectures go on. We didn't lose any time. I considered time as a factor. It was that factor, and accessibility. There were communication. We don't have barriers between registrars and the administrators of the university. I can easily talk to Madam Clarke, Dr. Rose Clarke Nanyonga, the Vice Chancellor of the university. I can access Madam Evelyn Gresayot, the registrar, Madam Emily, my faculty admin, the dean, everyone. And everything was positive. I just loved the comfort and everything. We didn't lose time, actually. That was the best factor about everything. Then given that we have clinicals every now and then, and yeah, the university is a good place. As you'll see, the ambience, we have it.
Wow. Did anybody tell you about Clarke International University, or you knew when you were still at your high school?
No, I didn't know. I actually mentioned earlier, my brother had a friend that had studied from Clarke International.
Okay.
Yes,
now I
Dr.
understand,
Jumba Moses. Yes.
Okay. So your brother was like, oh, somebody said that this university is really good.
Yes.
Oh, so recommendation.
Yeah, I had a recommendation.
Okay. Wow. Well, you mentioned something that's really, really important. There should be, a free communication, professional, of course.
Yes.
Between,
Emails.
students and, and teachers, I don't like it when teachers, or lecturers
Put
or professors,
barriers.
exactly, take them as semi-gods. I don't like that. I want a community where everybody can talk to each other, professionally, respectfully, but still talk to each other.
Yeah.
I love that. So if you can have that here, that's amazing.
Yeah.
So I would love to know more about what you do alongside your academics. You're now in your second year doing clinical medicine, but you also do other things in various in your community basically. So what do you do there?
So in my community, I'm working with an NGO, Teens Uganda.
Teens Uganda.
Yes, it's an acronym. Yeah, training, education, and neighborhood sustainability. Yes. So we handle a lot of things. We have programs on a community base. We are diverse. We're not particular to anything, but we are diverse. We shall have some health programs, gender programs. We have environment, food security. We are diverse, basically.
Wow.
So yeah, I wanted to get something I can give back to the community, my expertise, my strength. Wanted to help these people. So I joined the NGO and currently I'm part of them.
Wow. So when do you go to the NGO?
Yeah, my course is a full-time course, but we don't have lectures on the weekends. So that means basically Saturday and Sunday I'm free.
Oh, so use that time.
I use that time. I usually meet on Saturdays. Yes.
Okay. Wow, that's interesting.
Yeah.
And if you have some homework or any assignments that are pending, and you only have the weekend, right? So how do you balance, the work from the organization and then finishing the assignments? Because you only have the weekend to, to think so much about what you studied throughout, the week.
About that, people, I think I carried this culture right from my primary school. I never carry homework home.
Oh, wow.
I don't know, but those that were my friends in my primary school, no, we used to do all that homework, the weekend work. Even when I went to high school, I never keep work to myself. Like, even if a lecturer gives us 2 weeks for handing in, I'll do the work today as if the deadline is tomorrow. So somehow I end up having a lot of time on myself, and I read. I love, yeah.
Oh, wow. I mean, I don't know, but for me, if I had a long day, there is no way I can do anything about the homework. I have to
That's
first rest and then wake up and think about it.
That's me. But I try it. You guys will see it's something positive. You do. They give you coursework. At least even if you like they give you coursework on a Friday evening. Even if you stay awake the whole night, Friday, Saturday you're going to be free. You're done with your work, compiling everything. Even if it's a group presentation or what, you're done. You tell your group members to send in their contributions. Everything is done. The whole weekend, the whole time. By the time the deadline comes to pass, like you are nearing the deadline, everything, you'll just be chilling. Your friends are like, nah.
I don't want to change my sleeping cycle because I love sleeping a lot, so
I know, but you just stay it for the whole Saturday. You'll have the whole Saturday to yourself.
yeah, but you will be sleeping, on Saturday, because if you sleep late on Friday, then on Saturday you will be so lazy, you will be energyless.
No. Basically, lectures end at what time? 5, latest 6. You have all the time to 10. You mean you can't, most of this work, you can do all that work. You don't have to change your sleeping cycle. I don't think.
Oh, okay.
Yeah.
Well, it depends on the intensity of the work, And if it's academic writing, one essay, you need to think, you need to review various research and publish, review papers.
Yeah, you review papers.
So that takes a lot of time for you to really understand it. Yeah, it might take a lot of time.
Yeah.
So it might depend on the type of the homework you have.
It depends on the type of the homework, but still, if you're a reader, you keep getting involved. This literature is not new to you.
Oh yeah, that's true.
You won't really
totally
face.
agree.
Yes.
Yeah. If you're a reader, then things become really easier.
What do you consume? Even on social media, what are you consuming? Who are the people you follow on Instagram? Because some of these things, the research that has been covered and everything, these things are somehow, people know we don't love reading. They've put emojis, posters on the topics we are covering. So a YouTube video on what you are researching about. So basically, you have to keep informing yourself, getting informed. And by the way, I need to also mention this. We should not be fixed to one field. I'm a clinical medicine student. I shouldn't know anything about law. I shouldn't know anything. You should be diverse. The world today, my friend, you're doing medicine, you're mastering. So what? Everyone has done it. You need to have an added value. All round, diverse person.
Yeah, that's true. You get something from leadership, comment wide.
Skills.
Yeah.
Skilled, yes.
I totally agree.
Yeah.
I love the way you see the world. That's amazing.
Yeah.
So the next question is about the major challenges you've faced, as a lady who is doing science, and a lady who is focused, or a person who has so much hope in terms of changing how things are done, or contributing to how things are done regarding medicine. What are some of the challenges you've faced?
I think the challenges I've faced, basically, they're not very many. Yeah, the usual. But my major challenge, some of the girls in medical school, some of the girls pursuing sciences, or I don't want to close it to only sciences. The society, we as girls, the girl child, there is a way we're brought up to that men are inferior to us. So when an opportunity comes up, most of the girls don't want to take some of these responsibilities, and it's not that they are not taking, they are refusing them to take them up. Let's say leadership, or anything to do with class. You're supposed to do proposals. We think these things are meant for the boys.
So in that way, they think they are superior.
The boys are not superior, but the girls do not believe in themselves. I never want to be selfish, because I remember one of my teachers told me in high school, It doesn't. You lose nothing lighting another candle. You know, when you have one candle in a room, like there are 10 that are not lit, you've used one matchbox, this one is already lighting, you can use this very candle to light the the 9 in the room. You're going to you've used one matchstick, the room is brighter, you know, with 10 candles. You know? So when I light, it's like when I share information, empower another girl, I feel good. But most of these girls are not ready to take up these opportunities. I really do not feel good, you know? Guys, you should be confident. I don't know. You should view like it's a leveled ground. What a man can do, you can do. There is nothing like, this is for a girl. When your fellow peer, when Mariam comes up and they're like, let's try this. Girls, please, you should come up, you should come up, you should come up.
Oh, wow.
Yes.
So you've been in facing a challenge, you know, of, you know, approaching girls to do something and they're like,
oh,
can't
yeah.
do that. Oh, yeah.
I really feel bad on that side. And I end up having to go to the boys and the boys will be ready to do it. I'm like, oh, why don't they view the world in my view?
That's diversity.
Yes.
That's diversity.
Yes.
But what you're saying is very true, you know. Girls should always believe in themselves, you know. They should try to, you know, just see the world, you know, the way like you see it.
Yes.
If a boy can do something, they can also do it, and they shouldn't go with, you know, with what the society says, you know.
Yes.
Because societal views is not reality.
Yes.
So they should understand that this is a world where, you know, men and women can do exactly the same things. They just need guidance and passion for what they want to do. Nothing else, you know, and support, you know.
Support.
That's all they need. So they shouldn't be shy. Keep on doing that. Keep on, you know. If you go to any group of people, it's not a guarantee that they're going to accept what you're bringing in. But if you get somebody who can really listen to you and they understand, you know, what you're doing, and you do it together, if there's the results, you know, they start picking the interest. That is the problem with people. They take a long time to pick the interest, and sometimes by the time they pick the interest, it's too late for them to join it.
Yeah, you know, something else.
So crazy.
Yeah. So
what are some of the other, you know, challenges, you know? No, let me just not talk about challenges. Let me just, you know, ask you about, you know, some of the strengths, some of the things that keep you going, you know, to come this far. Because, you know, you fell sick when you were at your high school, you know. That was a very difficult time, you know, and that contributed to the loss of, you know, of the government scheme.
Yes.
At high
Bachelors,
school.
everything.
Yeah, exactly. So what are some of the things that have made you stronger? Can you tell us more about that?
First of all, I attribute all my strength and everything to Allah. I'm a Muslim. Yeah. So basically, if you're a believer, you believe in God. God, you should always put God first in everything. And even when you make it in life, you should never forget the prayer you made. You should always not take the might to yourself. You should always remember, oh, I made it this far, it was God. God is the number one factor. I get my strength. Then even the people around. People, please try to keep positive energy, positive company. You know, I'm supposed, even if you go to my contact list or anything, you should have a reason of every contact. Not like, okay, people think opportunity or what, money. You should not always think about money, but someone is impacting, positive impact, a skill. Even if you have that number of a lady who is weaving baskets, you didn't know that thing. What does it make? What does it take you to be a doctor and you know how to weave a basket?
Yeah, you can do both.
You can do both. So you should always, I think my strength are from the people around me. there are so many people. There are those ladies that have really stood, my mother, my aunties, my teachers, the beautiful ladies that have always been there for me. I attribute I think this far, what you see was actually made from my high school. Mengo contributed a lot on me as a person. And I think high school is a time you realize you build what you're going to be, because university, so many people, you're here for a short time. You know, but yeah, I think ladies of substance in my circle, I call them ladies of substance, women of valor. I always move, I'm learning from the best people, I think, to me. They may not be known but they're really impacting a lot on my life. My mother, Hajet, kudos, my aunties, all of them, not to mention Aunt Ida, everyone, so many people, so many aunties of mine, my teachers in Mengo, the beautiful ladies, Miss Chagulanyi, she was transferred to another school, but she was there the 6 years, she was dean, everything. Miss Boa Glorious, she was my class teacher for my senior 3, senior 4, yeah. So Miss Chigundu, she's very amazing. We talk on a daily, yes. I know she'll. Yeah, there are so many Mrs. Tamale. There are so many other ladies. I may not have mentioned you here, but I have all of you at heart. You people, the doctors, the friends I made in Ruaga Hospital, Dr. Sister Nelly, Sister Percy. I know all of you are so many people, but I may not mention. But you people, I attribute my strength and what I've become to you people. And I promise you, I'm not going to let what you saw in me, the belief you gave me, down.
Wow.
Yeah.
That's great. This is when, you just have to say, wow, I am so obliged to everybody who has contributed a lot, to my life and all the success. Because when you look back, you're like, if it wasn't them, it would have been so hard.
Yeah.
So, what I want to ask you is about, the major lessons you've learned. What are some of the major life lessons, you've learned, by going through all this you've gone through?
One of the
leadership and all that.
One of the major lessons I've learned in life is you should always see the good in every situation, however bad it is. The Muslims say when you're happy, you are supposed to say Alhamdulillah, thank you God. When you're sad, you're supposed to say Alhamdulillah, thank you God, because it's God. And what you're seeing, like even the Christians say, his plans are for you to prosper. The plans he has for you are plans to prosper you. Today you are in a bad situation. Today you are in hospital, bedridden. Today you've lost a parent. But you should always be positive. Look out for the positive in every situation. I'm telling you, the time I was sick, in and out of hospital, it was bad then. But today it's something positive. How? I got to learn a lot of things in hospital. I'm a medical student now. I'm doing what they used to do to me, what I saw my friends. I got connected to so many people, doctors in the field, in my line of field. I got to know so many people. So one thing I encourage everyone to have, you should always be positive. Avoid negative energy. One of my aunties, Aunt Christine, she always says, please, I don't want the bad energy. She doesn't want bad energy. When you surround yourself with people of bad energy, you end up being bad. Like the Bagandas say, Mbudia go itana,
that's true, that's true.
Empisazo, Zizo, go itana, you easily impact on each other. So some of the lessons, you should always see the good in everything. And people, you should be outgoing, very open, versatile. Opportunities come, you should never let them go.
Flexibility.
What are you using? Are you reliable? Do they know that Mariam and it for this and it for this? You should be diverse according to the world today, the competition, the job market, and everything. You don't need to have one skill or just entailed in your own profession. You should be diverse. I've learned diverse, being positive in everything. Above all, fearing God. People have mentioned God in this interview more and more. I attribute myself. And lastly, you should be humble. What you're achieving, what you've done, people have done before greater things than you. So, always keep humble. You're a student in high school, university. You don't lose a thing when you greet that askari at the gate. You don't lose a thing when you say hello to the lady cleaning campus. I don't lose anything. I create rapport with anyone. It doesn't reduce my weight. I'm a chubby person. When I greet them, it doesn't reduce.
It's
not going to reduce the money I have on me right there when I greet them. So please be humble.
Be humble and kind. That comes in with kindness.
Yes, kind.
Humanity.
And generous. Share the little you have. Yeah. I think those are the things. You view life in a different way. You see positivity. It all starts with positivity. Be positive. You are not always seeing bad in Annette. What are you offering Annette? You should always see the good in everyone.
Of course, I mean everybody, has that negative side and the positive side.
Yes, you should look at
something.
You close your eye to the negative side and try to see the positive. We need each other. Even the hands are not the same size, but just try chopping one and you'll see. Oh, this was important. Exactly. We need each other. We stand together, and this world surely is meant to be a better place.
Wow, and you're going to be part of those people who are fighting so hard to make it better. You're already making it better. Just look at all the energy that you were transferring to your fellow students.
Yeah.
That's a great thing. You see, when you work with smart people, you don't suffer that much. So, Mariam, you briefly mentioned about your time in the hospital. If you're fine with it, could you just tell us more about it? What was it, and how did you go through this?
Yeah, my time in the hospital, I got sick. I had this very bad headache, vomiting, numbness in the lower limbs. Before you moved in hospital. Yeah, one of my physicians, the first primary doctor that I saw, it was at Kampala West Clinic where they had taken me. I wasn't this chubby, guys,
No,
yeah,
you look fine.
I'm fine. I have no problem with my body. I love myself so that I can spread love. I have to first love myself. Basically, yeah, we went through a lot, but my first diagnosis was a pituitary macroadenoma.
And what is that?
A benign tumor on the pituitary gland. It's not cancerous, but it's a tumor causing benign, causing effect on the pituitary gland. So I had these hormones elevated, prolactin, cortisol, growth hormone, everything. But they tried controlling it. Then somehow I got better, and again I got a relapse. So they transferred me. They referred me to another physician. He's a senior physician and hematologist, Dr. Sally Francis. He usually has a clinic at Nakashero. And yeah, so we went. We had a very long. He clocked me for 3 hours, guys. It was very. I wish in my practice I work as he's my inspiration.
Mm.
He takes he takes detail of everything.
He pays attention
To detail.
Wow. Mm.
So we finally he requested for some blood tests, and they found out I have SLE, systemic lupus.
What is that?
Erythromitis. Yeah, it's an autoimmune disorder. Some of you read more about it. I don't want to have a lecture about that. So basically, I'm being managed for that. The whole time of it is I have multiple endocrine neoplasia 1 and SLE. But I'm positive. All that, I don't carry it on my head. I don't go on something I've learned. It's a positive living, guys.
I love the way, you live your life, because, when I met you, you were so happy whoever we meet, we've been going through the buildings, and whoever we meet, she greets them, with so much energy, with happiness. So, and if a person mentions that, oh, we are doing this, she's like, come on, I do this, I can do this, why don't you contact me? I'm here. I'm like, wow. Yeah. So this is how you spread love and energy to other people.
By the way, I did mention that, guys, spread love. And you can't spread love when you don't love yourself.
Yeah. Wow.
You're supposed to love yourself. Then you say, yeah, these people are good. They're good people around me. So, harmony. Peace and harmony.
Oh. Wow. Well, I'm so happy that, at least, the tumor was benign.
Yes.
And then, you are being catered for, you are being handled, by a person who you trust, the person you like. You understand? Because that also contributes to
all the doctors.
Exactly, yeah. So I'm really happy, and I really hope that you get better. Yeah. And you will get better.
I am better.
Yeah.
Though still on treatment or something, but I'm positive.
Yeah.
So many people with diabetes take medicine every day, hypertension. It's not only people with HIV. So we are positive. We are positive, yes.
Wow, I love that.
I am.
Yeah. Thank you so much, Mariam, for, having me here at the university and accepting to take this interview. When I heard about you, I was like, wow, I need to meet her. And, I don't regret, asking for your number and getting to know you. And I just hope that we remain friends, for this long time. And when you finish your course, I really hope that you can switch to medical oncology, and then I can kind of teach you some things. That would be nice.
I want to first go for the NCHB and oncology. My passion is neurosurgery.
Neurosurgery. Oh, okay, it's okay. Go with that.
No,
it's okay.
You never know. I may change. You remember, I wanted to do law, so I ended up. Never know, I may be there, and I'm touched. I'm in Cancer Institute, and I'm like, Mariam, oncology is calling you.
Let's hope for that. Wow.
Yeah.
Thank you so much, because by you telling all this information to our audience, you are making others stronger, because there's so many people who are going through a lot.
I know.
They might be going through something that is not related to their health, but they are giving up. But look at you. You've gone through a lot, you've experienced a lot, and some of the things you've experienced have led to the loss of some opportunities, but you still embrace that. You still embrace it, and you're like, no, it's okay, there is something positive in it. It induced me to do what I wanted, and I have good connections. That's a good way of looking, at life, and I'm so proud of you, Mariam.
Thank you, Annette.
So Thank you
I'm humbled. Thank you for the platform and everything.
Yeah, thank you so much.
Yeah.
Thank you so much, everybody. Thank you so much, Mariam.
Okay.
Bye.
Bye, guys.